Now, in this section, we'll be dealing with the removal of the spinal cord. Now, how is the spinal cord removed and why is it removed? It's not basically a routine course to remove a spinal cord in all of the cases of the cadavers. But if we have a transportational injury on hand, there is always a backlash to the spinal cord, to the vertebral column, and can get a damage the spinal cord. So we have to be very careful while dealing with such cases. And whenever there are chances of any damage to the spinal cord, we can basically approach it and open it and study it in detail. In this section, basically, we'll be dealing with all of these transportational methods and all of these methods of removal of the spinal cord. So there is an anterior approach while we're approaching the spinal cord, and then there is a posterior approach to approach the spinal cord through the vertebral column. And then there is an examination of the spinal cord in detail. We have to first of all examine it, the inspection of course, and the detailed examination of course. The sections of the spinal cord are inspected in detail, and then samples of the spinal cord are sent to the chemical examiner for further toxicological samples if they can be found out any. So in cases of any whiplash injuries, they can be observed in transportational injuries. In cases of the drivers and the front seat passengers, they usually acquire these whiplash injuries. And in these cases, we have to examine and we have to inspect and get a detailed examination of the spinal cord in detail. Now, how do we basically remove and examine the spinal cord? Now, the first step is made when there is indications that some lesion may be present. So, there should be some indication for opening up the spinal cord. There are two main approaches to reach the spinal cord. Of course, there is an anterior approach in which we remove the vertebral columns, and the dead body is on its face. And then there is a posterior approach to reaching the spinal cord. We'll be discussing both of these approaches in detail in the subsequent slides. Now, the anterior method. The vertebral bodies are removed after complete evisceration. So, how is this evisceration occurring? By sawing through the pedicles by a lateral cut down each side. And the advantages and disadvantages to this anterior method. Now, what is basically happening over here is we are removing the vertebral bodies and we are reaching the spinal cord through the pedicles anteriorly. Now, the advantages and disadvantages are body need to be not to be turned over onto its face. The extensive dorsal incision is avoided, and it is a more laborious method. So this is basically the disadvantage. The advantages were that an extensive incision is basically avoided, and the disadvantages are it is basically a more laborious procedure to basically put through all these vertebral bodies and then reach the spinal cord. Now, what is the posterior approach? There is always a posterior approach, and it requires a midline incision from the occiput to the lumbar region, and paraspinal muscles being reflected along with the subcutaneous tissues. So this is basically what is happening over here. It requires a midline incision from the occiput to the lumbar region, and two parallel saw cuts are made down the length of the spine. So these are basically the incisions that we are giving in the posterior approach, and the strip of the bone may be dissected off from below upwards to expose the spinal canals. So what are basically the disadvantages to the anterior approach are the advantages of the posterior approach. It is a less laborious procedure, and the incision is rather a little slightly more. There is a more longer incision in cases of the posterior approach, but the incision is less laborious. Now, canal is exposed in the posterior approach. The dura is examined for the hemorrhage and the infection or any other abnormalities. So we are looking for hemorrhages, we are looking for edemas, we are looking for infectious states, and any other congenital abnormalities. For example, spina bifida, and all of these spine abnormalities, they can be detected at this level when we are examining the spine in detail. Now, then they are removed by transecting the nerve roots and the dural attachments. It is peeled out progressively from below upwards, carefully opened with forceps and scissors to examine the cord itself. So what are basically the instruments that we are going to use at this level are basically, because it is a delicate structure, so moreover we are going to use the forceps or the scissors. Now, we have dissected the spinal cord, we have approached it, we have examined it a little bit, and now the detailed examination is it can be fixed in with formalin. So for the preservation purposes, we are using formalin because we have to send some samples to the chemical examiner for further details and some biochemical tests that can be performed on these specimens. Now, the samples taken for histology purposes as well, and note any crushing, any infection, hemorrhages, and degeneration. So these are all the things that we are looking for when we are examining a spinal cord. Now, the crushing and the hemorrhage factor is basically when we are dealing with a case of any transportational injury. The infections, it can be with anybody, and the degeneration is usually noted and noticed in the old age people. Empty spinal canal examination for disc protrusions, tumors, fractures, hemorrhages again, dislocations if there are any present at our hand, and the vertebral collapse, of course. So this is basically very important when we are dealing with a spinal cord examination. The disc protrusions, they are very particular for the spinal cord only. The tumors, now there can be Hodgkin's lymphomas and any other lymph nodes if they are present in the vicinity, that can be dealt in with detail. The fractures, of course, in any transportational injuries, as I've already discussed, and hemorrhages are also a feature of the transportational injuries. And now the dislocations. Dislocations can be due to any kind of trauma. And if there are any signs of a brutal traumatic asphyxia, the spinal cord can be damaged in those cases as well. And vertebral collapse is also a feature of trauma to the spinal cord. In a lot of cases, it can be any traumas, it can be any transportational injuries, or any direct traumas. Now, slide the hands under the back of the eviscerated body on the autopsy table. So this is basically some considerations that you have to keep in our mind, and lift the dorso-lumbar spine upwards while watching the interior vertebral bodies. If a fracture or dislocation is present, abnormally acute angulation will be seen. So we don't have a clear picture of fracture. We don't have x-rays on hand in cases of dead bodies. So basically, it is the acute angulation that is characteristic of fractures in the dead bodies. Cervical spine can be tested by the manual manipulation. So we have to, at this level, when we are examining the spinal cord, it is very important that we avoid any fractures at C6 and C7 levels because they are the undertaker fractures, and we don't want to mix the actual ante-mortem injuries with the post-mortem injuries that can occur during the autopsy procedures. So you have to be very careful while dealing with the spinal cord and the autopsy of the spinal cord, of course. So in this section, we dealt in detail how are we going to approach the spinal cord, and how are we going to detect any changes that are specific to the spinal cord. What are basically, it is not a routine examination. So what are basically the different modalities in which we specifically inspect the spinal cord? That was the end to this section. Thank you for watching sqadia.com.